Hi there. Thank you for joining us today for this Healthline 3 broadcast. I'm Jessica Crandall. Dr. Jagan Mohan joins us today to talk about non-surgical therapies for weight loss. He's with the gastrointestinal specialist here in Shreveport. He's here to answer your questions for the next half hour, so we'd like to encourage you to ask what's on your mind today. If you're online, just click on the orange Healthline 3 box. It's halfway down on the right-hand side of your screen. Type in your question online and submit it. I'll ask it on air. Or give us a call. This is a call-in show. We'd love to hear from you. The number to dial this half hour is 318-219-4569. We'll keep that right there on the screen for you throughout the remainder of the show, and we will be taking your questions until 12:30 today. Dr. Jag, that's what I'm going to call you today because it's so easy to remember. Thanks for being here today.
Thank you. I appreciate you.
Okay, so we're talking about a non-surgical way to have weight loss. Let's talk about this. It's a gastric balloon. What is it and how does it work?
It's called the Orbera balloon, and it's a silicone-based balloon that is inserted. It looks like a tube when it's deflated, and you pass it down the mouth into your stomach, and you inflate it with salt water, basically saline, about 400 cc's. And it's designed to work mainly by filling up your stomach, and it increases the time it takes for food to leave your stomach so that people feel fuller a little bit longer than usual. And when combined with diet and exercise, it's been shown in multiple studies to increase weight loss by about 3 times when compared to just simple diet and exercise.
Wow, that's an incredible number. How is the gastric balloon different from other procedures available for weight loss?
The other options for weight loss are basically, simple diet and exercise or something very drastic like bariatric or weight loss surgery. The gastric balloon fills that gap, where this is a very simple, office-based, non-surgical and less invasive procedure. It carries substantially less morbidity, less operative risk, and it's completely reversible.
So there would be a lot less risk to the patient.
That's correct. That's
Okay,
correct.
sounds like a good thing going for it. Well, who would be a good candidate for getting the gastric balloon?
Ideally, you should be motivated to lose weight, and you should be willing to follow a 12-month program of diet and exercise in addition to the balloon placement. The ideal candidates are people with a body mass index between 30 and 40. I still think people who have body mass index over 40 or people who have body mass index over 35 who have other weight loss, other health conditions would benefit more from bariatric surgery.
Okay, and that body mass index is calculated by height and weight, correct?
That's right. It's the height in kilograms divided by the weight squared. It's a little complex calculation, but there are a lot of apps. It's available online, or your doctor's office can calculate it for you.
Okay, Dr. Jag, we have a caller on the line for you already, so let's go out to her right now. This should be Linda on the phone line now. Linda, how are you, and what's your question for Dr. Jag?
I'm good. Dr. J, I was just giving you a call. My husband and I and my son and all were already patients of yours, but my husband had a question about him and my daughter. Do most insurances cover this?
Not yet. Unfortunately, insurance does not cover it at this time, but this may change in the future. This is like many therapies. Initially, insurance does not cover it, and as we get more information about this, it may be covered by insurance.
Right, and what does it usually, an estimate of what it does cost without insurance?
All over the country, the current cost is about between $6,000 to $8,000. It is still it's about $6,000 to $8,000.
Okay.
It's still substantially cheaper than bariatric surgery or any kind of lap band or any other surgeries.
Right.
Yeah.
Exactly. Okay. Well, that was one of the questions we were asking for, and we will probably giving you a call at your office.
Okay. Sounds good. Thank you so much for calling.
Thank
Great
you.
question, Linda.
Bye-bye.
Thanks for calling in.
Bye-bye.
If anyone else would like to dial into our Healthline 3 broadcast today, I'm talking to Dr. Jag with the gastrointestinal specialist here in Shreveport, and we're discussing a really exciting new way to have weight loss through a gastric balloon, which is less invasive than some of the other procedures out there. If you'd like to call in and ask a question about this topic, feel free to do so in the next half hour. The number to dial is right there on your screen. It's 318-219-4569. So let's go out to our phone lines again right now. We do have another caller already on the lines. This is Maxine on the line. How are you? And what's your question for Dr. Jag?
I was diagnosed with diverticulosis, and I was wondering what could I do to help it, because the GI I went to didn't give me no kind of information or nothing. Then he said I had holes in my colon, and he didn't tell me what to do or nothing.
Yeah. This is, though it's unrelated to gastric balloon, I would be happy to answer your question. Diverticulosis is a common problem that affects most adults over age of 40. We all develop these little pockets in our colon, and many times people have it and they don't even know it. In some people, these pockets can get inflamed and can cause what's called diverticulitis, or swelling of the colon, diverticular, and it can be dangerous. Sometimes it can lead to infection or abscess formation. There have been various studies that have looked at what will help to prevent these attacks from happening, and increasing the fiber that you take every day, limiting certain foods such as nuts and popcorn. You don't have to completely stop it, but if you're a person who eats it a lot and you've had attacks of diverticulitis, I ask my patients to scale back a little bit on those, on such diet. And in some patients, if they have recurrent attacks of diverticulitis, they may even need surgery to fix it.
Okay. What about the holes? What's the holes in the colon? What can I do for that? Surgery?
They're not really holes. They're more like pockets or pouches. So you shouldn't be worried about holes. It is definitely not a hole. Yes.
Okay then. Okay then.
Good to know. All right. Any other questions?
No, ma'am. That was all.
Okay, good deal. Thank you so much for the phone call.
Okay, thank y'all.
If anyone
Bye-bye.
else would like to call in to Dr. Jag today, here with the gastrointestinal specialist of Shreveport, feel free to do so. The number to dial is right there on your screen. It's 318-219-4569, and we're discussing a weight loss procedure that is a gastric balloon. It's less invasive than some of the other surgeries and procedures out there. We have another phone call for you, Dr. Jag, so let's get right out to that. Rebecca has dialed in, so let's go to her. Rebecca, how are you, and how can we help you?
I'm fine, thank you. I wondered if there was an age limit on anyone that could have the balloon type surgery, and I'd like to add that I am a diabetic.
Mm-hmm.
Great question.
Yeah. It is currently indicated for adults, not for children.
Yes.
There is no real limit on upper age limit on who can receive the balloon, but ideally I would say about an age of 70 would be the maximum. We wouldn't do it for somebody who's more than age 70.
Okay.
And as far as diabetes, it's a very interesting question, because many patients who get bariatric surgery, there is substantial improvement in their diabetes, and you do see a lot of changes and improvement in diabetes just with diet and exercise if you can lose weight. And because this balloon has been used in several countries, there are many studies that looked at this, and at 1 year there was a substantial improvement in diabetes and high blood pressure. These are two parameters that they looked at, and there was improvement with weight loss. So yes.
Okay.
Mm-hmm.
Well, I thank you for answering my question then.
Not a problem. Thank you for calling.
Thank you. Bye-bye.
We appreciate all of our callers who have dialed in today. If anyone else would like to call and ask a question to Dr. Jag, the number to dial is 318-219-4569. So Dr. Jag, let's talk a little bit more about the details of this balloon. How long would it stay in a patient?
The balloon itself is designed to stay in a patient for about 6 months. The balloon itself is only the first step of the weight loss process. After placement of the balloon, the patient enrolls in what's called the Orbera weight loss management system, which involves a tailored program that is created for the patient by a dietitian, the physician, and an exercise physiologist The main goal of this is to create sustained changes in your dietary and exercise habits that'll help you in the long run, and basically achieve changes in your lifestyle, and help you maintain the weight loss over several years, even after the balloon is removed, because the balloon itself is removed in 6 months.
Okay, sounds good. We have a couple more callers on the line for you, Dr. Jag. So let's go out to them so we can answer their questions. The first one, we'll go out to our first caller. We don't have a name for you, so hopefully you can hear me if you're on the line. We'd love to hear your question. Hello, are you there, caller?
Yeah, is it me?
Hi, yes, we'd love to hear your question for Dr. Jag.
Yeah.
Thanks for calling in.
I had a question.
Yes.
Can a person who's had the gastric bypass surgery use the balloon if they were unsuccessful with the bypass surgery?
No, unfortunately, the balloon cannot be used in somebody who has changed anatomy or who have had surgery and had part of the stomach removed. Unfortunately, that's a limitation of the balloon at this time.
Did
Thank
that
you very
answer your
much.
Thank you.
question?
Yes, thank you.
Okay, thanks for the phone call. We really appreciate it. Let's go out to our next caller now. Miss Cummings is on the line. Miss Cummings, how are you? And what is your question?
Fine.
Go right ahead.
What I'd like to know is, can the doctor do the procedure if you've had the stapling or the balloon wrap around the upper part of the stomach?
Stapling, yes, but a balloon wrap, it depends on how much or how functional your balloon wrap is. At this time, the general consensus is to avoid doing this in somebody who has failed another kind of surgery, and any kind of alteration to the stomach. It is probably safer not to do this, in my opinion, to prevent complications.
Any other questions there, Miss Cummings?
Well, he probably can't give the price, can he, in his name?
Sure,
Yeah.
the price in your name. Is that right?
I'm sorry?
You asked for the price of the procedure?
Yeah.
Okay.
Yeah, it's going to be, we
Correct.
expect it's going to be about $6,000 to $8,000. And it's unfortunately not covered by insurance at this time.
And how can she get in touch with you at your practice?
Yeah, please call us at our office, gastrointestinal specialist is 631-9121. And many of our doctors are going to be performing this procedure, so you should be able to get in touch with the physician who will be able to help you.
Did that answer your
Okay,
question?
thank you.
Okay.
Thank you.
We really appreciate it. To everyone who's
That will
called
be
in
all.
today.
Thank you.
Thank you. If anyone else would like to dial in, the number to call is 318-219-4569. I'm here with Dr. Jag from the Gastrointestinal Specialists of Shreveport. So let's talk a little bit more about this gastric balloon. I think you brought a video along to actually show
Sure.
people what it looks like.
Yeah. So the balloon itself looks like a tube when it's deflated. It's passed down your mouth into the stomach, of course after sedation, and we use a flexible scope which has a light and a camera to follow it to make sure it's in the right place. And it is then inflated with about 500 cc's of salt water or saline and then left in place. And it is a simple office procedure. It takes about 20 minutes to perform, and people usually can go home right after the procedure, and
Wow.
The sedation would wear off in a few hours.
That's pretty incredible.
Yeah.
How long has this procedure been around?
Uh, so as I said earlier, the gastric balloons have been available since about 1985,
Okay.
but technology was not very good at that time, so it was kind of fell out of favor. But in 2005, it was reintroduced. This company, Orbera, released this balloon, but it was available in about 80 other countries before being available in the U.S. Since about August of this year.
So it's gotten much better and the results
That's
are
correct.
good.
That's correct. And we have more information on how to use them and what are the outcomes of using them. Over 200,000 people have gotten the Orbera balloon around the world.
Wow, so this is a tried and tested way
That's
to lose
correct.
weight.
That's correct.
How much weight can a patient expect to lose from this?
Most studies have shown about a 10% weight loss of your body weight. On an average, in a large study, they were the average weight loss was about 33 pounds. And again, I'm going to emphasize the importance of diet and exercise.
Right.
The balloon is just an additional boost, along with diet and exercise, and change in your dietary and exercise habits, which has to be sustained, which will provide you with long-term results.
You've got to pair it with that change of lifestyle
That's
as well.
correct. That's correct. Absolutely.
Okay, so what would be the immediate expectation someone could have following surgery?
Immediately after surgery, as sedation wears off, most patients will have nausea and vomiting, and this is a very common side effect of this procedure. It lasts for about 2 or 3 days, and usually is well managed with medications and rarely with IV fluids and things like that. It is just basically the body getting used to the balloon being inside you, and over time it kind of adapts, and in the next few days people start feeling much better.
How long would it take to actually lose the amount of weight that you just specified?
It's interesting because about 80% of that weight loss happens in the first 3 months. So people
Wow.
start drastically losing weight to the point in some countries this is even called as the wedding balloon, because people get this balloon before some event where they want to lose a lot of weight. But at 6 months, people continue to lose weight, and even when you take the balloon at 1 year, people continue to lose the weight, which is sustained along with diet and exercise, basically.
Okay, who would not be a good candidate for this?
Patients who've had surgery, as we had talked about, and patients who cannot follow a 12-month plan of diet and exercise, are not willing to change their dietary and exercise habits, are not going to achieve very good results with this, or in fact may not even achieve any results. So as a physician, diet and exercise is what I emphasize with all my patients, and that's paramount in this case as well.
We had a caller earlier who was a diabetic, for anyone who's just tuning in, who had a question about whether or not it would be a good procedure for her. What is your recommendation for diabetics?
The official consensus, or at this point, there's no official recommendation that all diabetics should undergo this procedure. But if you are a candidate otherwise, if you have a BMI, body mass index between 30 and 40, and you have tried diet and exercise, and you do not want something very drastic like a surgery, like a bariatric surgery, this would be a good option to help you lose weight, which in turn would help in your diabetes and blood pressure management.
Fantastic. Good to hear. Those are great results. Let's go out to our phone lines. Once again, we have another caller who is dialed in to talk to us. Let's go out to Joe. What's your question for Dr. Jag?
I would like to know what the ages are that you can have this surgery.
Yes, this surgery is intended for adults, not for children. It is there's no set upper age limit, but at this point we would limit it to somebody less than age 70.
Well, I'm 69, and
There's always that
that in
the
between
caller,
age.
that in between age. Absolutely. If this is going to help you substantially, and you're motivated, and you've tried diet and exercise, and you qualify for this, yes, you should definitely consider this as an option.
do y'all take Humana insurance?
We do take Humana insurance, but unfortunately at this time insurance does not cover this procedure. This may change in the future, but at this time there is not insurance coverage, which I hope will change.
Well, about what would it cost?
As I was telling earlier, it's going to be in the ballpark of about $6,000 to $8,000 because insurance doesn't cover it, and it involves procedures.
Okay. I've got a 16-year-old that needs it. Is she too young?
Yes, she is. She is. It is intended for adults, but again, this is something new in the United States, and I'm hoping, as a clinician, that there will be more and more research. We all know childhood obesity is a problem, and some reversible option like this in children. You do not want to do something very drastic like a bariatric surgery. Something reversible would be a great option, but again, it has to be time tested. It has to be tested in studies, and a lot of clinical research is being done at this time.
You don't have no 16-year-old.
My wife, you done some surgery on my wife
Okay.
on her pancreas
Yes.
2 or 3 years ago, and you've done a real good job.
Thank you. I appreciate it. Thank you. I'm glad she's feeling better.
Okay, well, I'll be in touch, and I appreciate you.
Not a problem. Thank you, sir.
Thank you so much for calling in. We appreciate it, Joe. We hope your 16-year-old gets the help she needs. So, Dr. Jag, we had a caller that dialed in to ask if you would give them your information about how to contact you, and also give them your full name so they know who to contact.
Okay. My full name is Satya Dr. Jagan Mohan. And I'm a gastrointestinal specialist. We're a group of 13 physicians. We are very well known in the community. We have specialists from all over the country who have trained in big institutions like Mayo Clinic, MD Anderson, Penn State. And our number is 631-9121. And you can find us on the web on www.gis.md.
Perfect. Sounds good. And they can call in and just ask for Dr. Jag, right?
Absolutely. You can call and ask for Dr. Jag, and we actually have set up a center for nutrition and weight loss at GIS. So when you call GIS, you can ask for the GIS Center for Weight Loss and Nutrition, and they will be able to connect you to our nurse and coordinator who specifically deal with patients for gastric balloon placement, and they'll be able to guide you and coordinate further care from that point.
That's Dr. Jag, J-A-G. I know sometimes it's hard to hear it when you say it on air, so I'll spell it for you. Okay, so let's get to another caller who's dialed in for you, Dr. Jag. We'll go out to Mary on the phone line now. Mary, how are you, and how can we help you today?
Well, I wanted to ask the doctor if this applied to somebody that when they were born, that they were like weighed about 9 or 10 pounds, and they've always had a weight problem, and they don't eat. They're not big eaters. They just they always had a weight problem, and so I wonder, should they be checked out first for like thyroid or maybe hormones or something like that might be a problem?
Absolutely. It's a great question. There are numerous things that can affect weight gain. Though diet and calorie intake and lack of exercise has been a well accepted factor, there are numerous other factors that we are still researching on. Absolutely, other problems like like a thyroid problem, problem with your pituitary gland, and a lot of other things have to be really evaluated by your physician to rule out anything like that could be a cause for excessive weight gain that's unexplained.
Did that answer your question, Mary?
Yes, thank you.
Great. Have a great day. Let's go to our next caller on the phone lines who's dialed in. We'll go to Lisa now. Lisa, how are you, and what's your question?
I'm doing good. How are you?
Great, thank you.
I'm 5'3.5", and I weigh 170 pounds. 170 pounds. I'm sorry. Is that too much? As short as I am, and I'm a borderline diabetic.
I didn't get your height, ma'am. What is your height again?
I'm 5'3.5".
Okay. I cannot calculate your body mass index on the top of my head, but that'll be where I would start. I would you can go online and look for BMI calculator, and you will be able to put your height and weight, and you can try to see where you're at in your body mass index. If you're between 18 and 25, that's considered healthy.
Okay, I have real high cholesterol and blood pressure.
Okay. But I mean, are they medically managed? Are they controlled?
Yes, I take medicine for it.
Okay. Again, you know, if your body mass index is between 25 and 30, we would still recommend exercise and diet. But if it's between 30 and 40, yes, you can consider, you know, the balloon. Definitely, it'll be an option for you.
Okay.
And just on the top of my head, I don't think your body mass index is over 40. So, you know.
Okay.
So, yes.
Thank you. Have a good day.
No problem. Thank you.
Thanks so much. You too.
Thank you, Jessica.
Appreciate it. We have just a few minutes here left on the show. We have a couple more callers, and we want to get through them fairly briefly. So if they could keep their questions pretty quick for the doctor here, we'd appreciate that. So we'll go out first to Deborah. Deborah, how are you, and what's your question?
Yes, how you doing? I've had gastric bypass surgery before and gained weight. Would I be a candidate for the balloon surgery?
No, ma'am. Unfortunately, you know, we've had this question earlier as well. Unfortunately, you will not be a candidate for the gastric balloon. Any kind of gastric surgery that has been done before can increase the risk of complications with this balloon, and hence it's at this time it's not recommended. Again, it may change, or there may be newer variations in this balloon over time, over the next few years. I would ask you to stay tuned, but at this time, unfortunately, you cannot have this balloon placed.
Okay, thank you.
Thank you so much, Deborah. Okay, we'll go out to Becky now. Becky, how are you, and how can we help you?
Yes, like I just want to ask, I used to be like 370 pounds at one time, and I lost a whole bunch of weight. I am like 232 right now. I go to a gym every day. I train for 4 hours a day.
Wow.
But I'm still a plus size girl, and I eat healthy and everything, but I cannot lose the weight like right now. And I talked to my trainer about this. My trainer said that like I need to try like the band around the stomach. Would you say that this was more healthier, or the other one that the balloon is?
Absolutely, absolutely. And did you tell me earlier that you had gastric bypass surgery?
No, I haven't.
You haven't had. Okay.
No.
Yeah.
No.
Yes, you will be an ideal candidate for this procedure, especially how committed you are to diet and exercise, and you're and it's ideally suited for somebody who works hard, who's tried to lose weight but just cannot achieve that goal with just pure diet and exercise. Yes, you may be a good candidate for this procedure.
Okay, well, I am 26 years old. Like, would that have to do with anything, or would that be a good age?
That is a good age. There's no problem with that. Yes.
Okay, and what's your number again?
It's 631
Wait, let me get it.
9121.
631
9121.
9121. Okay, and this is to your office, right?
Yes, this is to our office. Our office is called Gastrointestinal Specialist, or GIS, or you can find us on gis.md, and you can even fill up forms online, and you'll be able to get our coordinators very easily.
Okay, well, I'll be seeing you like very soon then.
Okay.
Good luck,
Right,
Becky. Thank you.
Thank you.
Thank you so much.
Okay, so I'm going to have our directors pull up the picture that we have of the balloon itself that we've been talking about this whole time, so people can actually see it in the last few seconds that we have here. So this is an actual picture of the balloon, right,
That's
Doctor?
Correct. That's correct.
Okay.
Yes. It's again a silicone balloon, and it's designed not to be damaged by the gastric juices, and it's easily it gets deflated into a tube which can be easily inserted and filled with saline to occupy space in the stomach.
And this is something that you would eventually take out of the person after they lost the weight. Are you offering this procedure right now for people, and how can they get in touch with you?
Yes, we should be offering this procedure in the next month or so, since it was just recently approved by FDA. And people can get in touch with us online, or they can get in touch with us by calling our offices, and we're always available to help.
Okay, will you give me the number to the office one last time?
Yes, it's 631-9121, and it's a gastrointestinal specialist, also at gis.md.
Okay, Dr. Jag, thank you so much.
No problem. Thank you.
Thanks for joining us.